People have started joining. So gradually, as more people join, we will be starting today's presentation after a gap of a day, and we'll be talking about breastfeeding and complementary feeding. Of course, again, this lecture will not be finished today. Maybe it will take another hour to finish both the breastfeeding and complementary breastfeeding. And I know that people who are joining here are from different background, from undergraduate to postgraduate to faculty also. So, but my question is mainly to undergraduates as well as the postgraduates, especially to the postgraduates if they are here. If some of them have joined by now, they can answer the question by typing it in the chat. That when you were undergraduates, how many hours of breastfeeding or complementary feeding was taught to you? Any answer? Anybody who would like to write? Any postgraduate who is here from any college, that how many hours were used to teach you breastfeeding and complementary feeding, whether in community medicine or in pediatrics or anywhere? And now this question is open to all. That another question is open to all because I'm not getting any responses. So this question is open to all. We say the breast milk is the gift of nature. Then what do you think that in our country, approximately 2.5 crore women, they become pregnant every year, and they may be having different educational backgrounds. They may be literate, they may be illiterate, they may be professional, they may be engineers, they may be chartered accountants, they may be graduates or postgraduates, but where the breastfeeding is taught to them, and where the other related targets which we have discussed in the previous lectures are taught to them. Does anybody give them a target that you have to give breastfeeding because this much of growth has to be achieved by the child by the end of, say, 4 months, or by the end of 6 months, or by the end of 1 year, and so on? And that is why it is important to use this. That is why it is important to give breastfeeding and exclusive breastfeeding. So there are a lot of questions. Basically, there are a lot of questions which comes to mind, and that is why we kept the title of today as Art and Science of Breast and Complementary Feeding. We'll be more talking about the art, because that is required. We'll be talking more about the techniques. We'll be talking more about the myths or the misconceptions which are there in the mind of the mother, and especially the mother who have become mother for the first time. They have a lot of questions in their mind. So they have a lot of questions, and we'll be starting with those questions first of all. We'll be starting with those questions first of all. What various kind of FAQs, that is frequently asked questions, are there when we talk of breastfeeding? And if you are able to answer these questions, only then probably you will be able to convince the mother or the would-be mother or the future mother as far as the implementation of breastfeeding is concerned. So here we go. What are these FAQs? These question number 1 is, I do not know how to feed. Is it a valid question? Yeah, this is the most valid question. So what we can do about it? What answer is there for this particular question? We will be talking about that. I have to send the link to somebody. Somebody is asking for the link again. That's a problem. People don't check. Then the next question which comes to the mind is no milk production. No milk production is a very, very valid question, because even if the milk is produced, the mother is not able to see how much milk is coming. Can mother know how much milk is coming? She can never know how much milk is coming. So, and that is the reason when they are not able to see, then they usually think that whatever milk they are producing is insufficient, and they always try to shift to easy option, that is the top feeding or bottle feeding. Then the next question which comes to mind is that milk is not enough or sufficient. Again, we have discussed this, that because breast milk cannot be seen and cannot be measured, so there is always a query in the mind of the mother whether my child is getting enough milk or not. And the next question is, my child is asking milk every half hour to 1 hour, whether it is a daytime or a night time. What should I do? How can I be awake 24 hours a day for days together? So what these are the problems which the first time mothers they face, and you have to have the answers of that. Then the next question which comes which is very, very common is that my child is passing frequent motions, and child is passing motion every time I feed the child. So my child is passing 6 to 8 or 8 to 10 motions or 10 to 12 motions per day. I think he or she is not able to tolerate my milk. And what should be done? Should we treat this child for anything, or we have to again do the counseling to the mother depending upon the scientific evidence which we have? Then the next question comes is, on one hand, the problem of frequent motions. On other hand, the problem of no motion for 3 to 5 days. My child has not passed motion for 48 hours. Mothers becomes panicky. Something is wrong with my feed. Child is not passing motion. How is it possible? Because we pass motion every day, so child also must pass motion every day. So we will have to get the answer of these questions, and during the course of the deliberations, if you are able to get the answer of all these questions, I think then the purpose will be fulfilled, and you will be in a much better condition to provide a right kind of education to the mothers, so that you can sensitize the mother, the sister-in-law, or the mother-in-law, or the head of the family, or the other family members regarding the importance of exclusive breastfeeding, which we discussed in the previous lectures also, that it is important because it is optimal for the growth, as well as it prevents 17% of infant mortality. And the next and the most important question is, why should I breastfeed when I have another option? Especially this is a question which is asked by the working mothers. Nowadays, of course, the government has given 6 months maternity leave. So, and that is why the maternity leave was increased from 3 months to 6 months, so that the mother can feed the child optimally up to the 6 months of age. And even if a lactating woman is there, then she may be given some time off during the working hours to feed the child. These are the guidelines. And then the next question comes is, that for how long should I breastfeed? So these are the questions which are there in the mind of mothers, which we have experienced over a period of 3 decades. That these are the main issues, and if you can solve these issues, and of course, I told you in the beginning also that the best time to give this education is antenatal period, or prior to best time is antenatal period, because at that particular point of time the pregnant woman is much more sensitive towards the education part, because she knows that she's going to produce a child. So that is the, you have to keep that thing always in mind, that yes, that is the critical period. Because if you start giving education to the mother after the mother has delivered, then it will not fully serve the purpose, right? So there are a lot of difficulties, and we'll be talking about that. But there are a few FAQs regarding complementary feeding, which I think we can take it later on when we go to that. We'll skip. So what are the objectives? So mainly we will study the composition of the breast milk and its advantages to the infant and mother, which all of you know. Then we'll study exclusive breastfeeding and complementary feeding, and then we'll study the baby-friendly hospital initiative. Then we'll talk about the BFCI initiative once again, which we discussed in the prevention of childhood malnutrition. So, we'll be trying to answer the queries or the questions which were raised for how much time the exclusive breastfeeding should be continued. And we discussed at that particular point of time that initially WHO said for 4 months and then for 6 months. And for this, you will have to understand a bit more. And this is again the data that with the strengthening of the JSY and JSSY, what has happened is the institutional deliveries have increased in our country to 79%, and exclusive breastfeeding has not increased similarly. It is only up to 54%, and complementary feeding is still far poorer than the exclusive breastfeeding, that is only 43%. So, and within first hour, again, it is only 42%. And so we discuss the various cultural factors, and this is again showing you the increase in NFHS 3 and 4. Now, let us start. Breast milk. The breast milk is the best milk for the infant because it is produced by nature. It is produced by nature. Now, under any circumstance, breast milk is the ideal food for infant. No other food is required till 6 months of age as per WHO. Now, you'll have to understand what is the requirement of milk. When a child is born, suppose we say a child is born with 3 kg of weight. So, her milk requirement is 60 ml per kg per day. That means if he's 3 kg child, he will be needing how much? 180 ml of milk. He'll be needing this. That is how we calculate the requirement, and then we keep on adding 10 ml every day, so that by 10th day we reach to a figure of 150 ml per kg per day. That is the requirement. That is, on one hand we say this is the requirement, but this is it true that 180 ml of colostrum will be produced if we are going to put the baby on exclusive breastfeeding? We'll get the answer in a few moments. It is not possible to have this much of colostrum, but colostrum is again very, very important. Then you will have to understand, yes, now let us discuss that question which was asked in the previous presentation, that yes, why I am saying it should be up to 4 months or it should be weight related. Now, if you concentrate here and if you look at the 4 month, then, and if you look at it, this is cutting, the 50th percentile is coming at around 7 kg. And this is because the weight of the child here shown is above 3.2 kg or something like that, and the formula which we have given you is again 3.6, something like that. That makes 7 kg up to the age of 4 months. That is what is the analysis of this particular growth chart shows us. So if we calculate from 150 ml per kg, then at 7 kg of weight, the child will be needing how much milk? More than a liter. And if we calculate by the previous growth charts, which was around 6 kg, even then the child by the end of 4 months, if he is growing optimally, will be needing 900 ml of milk, 900 ml of breast milk. Now, as we go further, then we'll talk about, I'm not talking about here the calories and other things which we discussed last time also. So in the WHO document, if you read that in between the lines, it is also written there that if you have the facility of weighing the child, then it should be weight related. It should be weight related. But then WHO makes only one recommendation, and there cannot be two recommendations, that 4 months for this child and 6 months for this child. And if somebody asks you in the examination, then yes, your answer should be that the exclusive breastfeeding should be given for 6 months. But if some literate parents you are treating, or you are counseling parents, literate parents or illiterate parents who are conscious about the growth and development of their particular child, then you can always tell them that yes, you have to take the weight of the child regularly, continuously, and if the child is growing, then you have to understand that if the weight of the child has crossed more than 6 kg or so, then that is probably is the point or time that you have to start complementary feeding. Otherwise, your child will be at a disadvantage. And I always say the recommendation for workers and recommendation for doctors can't be same. Doctor have to know more. So we end it here. We keep it to peace to this controversy, 4 months or 6 months. Yes, somebody asks you what is the WHO recommendation, it is for 6 months. From the examination point of view, at personal level, what data I have shown you, what chart I have shown you, what requirement we have discussed, it has to be done accordingly. Then now this is the average volume of secretion of Indian mothers, 600 ml. But some people say that if the requirement is more, then the mother is able to produce more. And maximum it can go up to 800 ml. And what are the constituents? The fat contains, the human milk contains 3.4 gram of fat per 100 ml, protein 1.1 gram, and lactose 7.4 gram. And you will be coming across few children who will be having primary lactose intolerance, or who suffered from diarrhea because of the wrong treatment, or they really suffer from bacterial or viral diarrheas, and then they become they suffer from secondary lactose intolerance. In those women, what is to be done? Whether we have to stop the breastfeeding, or we have to use some alternative mechanism by which we can reduce the amount of lactose in the breast milk which the child sucks. So that point you'll have to keep in mind. Then the breast milk contains calcium 28 milligram per 100, and vitamin C is only 3 milligram, minerals 0.1 gram, water 88 gram, and energy it provides you 65 kilocalories. And if you do a calculation from 65, then what we have discussed amount of calories will be further less. Then there is a term, if somebody is giving breastfeeding, exclusive breastfeeding beyond 6 months, or giving only breastfeeding up to the age of 8 months, 9 months, or 1 year, then what is it harmful to the child? Yes, it is definitely harmful to the child. Number one, from the growth point of view. The other term which we use is that is known as milk injury. Milk injury. I hope some of you would be knowing what is milk injury. Milk injury is when you are continuing exclusive breastfeeding beyond 6 months of age, and you don't give any supplement, you don't give the complementary feeding, then the child is not able to get adequate amount of vitamin C and iron. And C and iron are both important because C increases the absorption of iron inside the gut. So there are more chances that the child will become anemic, and this usually happens in those mothers who are neither aware of nor have been sensitized by the health system to up to how much time the breastfeeding or the exclusive breastfeeding is to be continued. Then yes, colostrum is very, very important. Colostrum is thick yellow to orange color milk produced in late pregnancy and in the first week of lactation in low volumes. The importance of colostrum is that it is low in fat and high in carbohydrates and proteins, and it contains antibodies. Now the kids who are given colostrum, they are protected from various illnesses. They are protected from various kinds of enteropathies also. They are protected from various kinds of allergies later on in the life also. So colostrum is very, very important. And the problem is this: when a newborn child is delivered, if the mother is not sensitized, then she sees that very thick yellow or small yellowish fluid is coming, which she thinks is not milk, but it is milk. It is colostrum. It is a prerequisite requirement, and that is why at times this question is asked: what is first vaccination? What is first vaccination? The first vaccination again is the giving breastfeeding or colostrum. Why we call it vaccination? Because it contains antibodies. So that is why it is also called as first vaccination, because you know that in a normal delivery that you have to give the breast to the child as early as possible, maybe within first half an hour or so, right? So that is why it is also known as first vaccination. Then the benefit of the colostrum feeding: it is a perfect food for infants in the initial days. It has got a laxative effect. It clears infants' intestine of the initial stools, and it prevents the occurrence of physiological jaundice also. It also contains leukocytes, which prevents infection. It contains IgA, which also provides immunity. Now, when the mother hears that the colostrum is measurable in teaspoon rather than ounces, they often wonder if that can really be enough for their babies. The short answer is that the colostrum is the only food healthy full-term babies need. The following is an explanation. What is the explanation? A 1-day-old baby's stomach capacity is about 5 to 7 ml, or about the size of a marble. Interestingly, researchers have found that 1-day-old newborn stomach does not stretch to hold more. Meaning by, if the capacity is 7 ml and you want to give 10 ml at one point of time, what will happen? The stomach wall is firm. So what will happen? The extra milk is often expelled or spit up. So remember, when the lady becomes pregnant and delivers, only then the breast milk is produced. Prior to that, it is not. It is produced by the nature, and nature is producing adequate amount for the normal growth of the child if we are able to follow the rules of the nature, right? So your colostrum is just the right amount for your baby's first feeding. Of course, we are talking of a normal birth weight child. We are not talking of low birth weight child, because low birth weight child, they have their own problems. They are at a higher risk of going into hypoglycemia. So maybe you have to take care in a different manner as far as those kids are concerned. Now, by day 3, the newborn stomach capacity has grown to approximately 0.75 to 1 ounce. And 1 ounce is approximately how much? Is 30 ml. 1 ounce is equal to 30 ml, about the size of a shooter marble. Small frequent feedings assure that your baby takes in all the milk he needs. And around 7 days, the newborn stomach capacity is now about 1.5 to 2 ounce. That is around 45 to 60 ml or about the size of a ping pong ball. Continued frequent feeding will ensure that your baby takes in all the milk he needs and your milk production meets its demand. So these are the few facts which are there, which you'll have to remember. But then you have to remember that here we are talking about a normal birth weight child. We are not talking about a low birth weight child. The situation is different for them. So this is a pictorial presentation that day 1, day 3 and day 7. Then the timing of the breastfeeding. The breastfeeding should be started as early as possible after delivery, within half an hour of normal delivery and within 3 hours of cesarean section delivery. Now I can share with you a lot of my experiences as far as cesarean sections are concerned, because majority of time mother thinks that if they have undergone an operation, they will not be able to feed the baby. This is not correct. If good nursing care is provided, then any good trained nurse will put the baby on the breast of the mother, support the mother, and allow the mother to suckle the baby on her breast, and gradually the lactation will establish. The other thing to remember is suddenly there will not be a free flow of the milk, and initial 2-3 days are of crucial importance, because that is the part of time where you'll have to persist for breastfeeding, because the amount of colostrum which is produced in 2-3 days is less, and the mother has to persist. Number 2 point is the lactation establishment takes time. Number 3 is both the child and the mother, they are new to this phenomena. And number 4 is that when the child suckles at the breast, it is an active suckling. And of course, everybody in life wants to do the easier job. And if you give the baby a bottle during that period of time, which is usually happening in the institutional delivery, especially more so in the private sector, where a list is always given to the husband or the caretaker, that yes, you have to bring a bottle and you have to bring a powder milk for the baby. So there is another term which is important to understand, and we will discuss that here right now. Is that term is known as a nipple confusion. Because we have done counseling of thousands of mothers on these issues, that is why I'm sharing these things with you. That nipple confusion is, if you give a bottle to a baby, then baby does not have to suck it forcefully. Baby just put the nipple into the mouth, and you just keep on raising the level of the bottle, and it is not that forceful sucking which is required when the baby is taking milk from the breast. So the baby gets confused because bottle feeding is easy. And then what happens if you give nipple of the bottle and you continue with the breastfeeding also? Then what will happen? Everybody wants to do the easy job. The baby also wants to do an easy job. So then when you put the baby on the breast, then he starts crying and does not accept. And the mother thinks that something is wrong, and why the child is crying. And then she takes bottle and give bottle again, and the smart infant start taking the milk from the bottle because it is easier for him. So every time it creates a confusion in the mind of the newborn child. What should I do? And you must understand, a newborn child always respond with only one thing, that if he is not satisfied, he will cry. So that is important point to remember, that yes, that is why we said, when we were talking about the causes of malnutrition, then we were talking about the incorrect child rearing practices. And at that particular point of time, I said the person who invented bottle was the biggest enemy of the mankind, right? So you don't have. And even if the need is there, then all of you must know that if in some special circumstances the need is there, then you can always use the Paldai feeding. Paldai is available. You can Google it, and you will find a boat-shaped like uh, structure which has got a pointed tip. You can put the milk into that and just raise the level, and gradually the amount milk goes into the mouth of the child, and child is able to drink that. But then it avoids nipple confusion. In exceptional circumstances, you must understand, in exceptional circumstances, yes, you can go for a Paldai feeding, but that is only in exception. And when I am talking about this, then I remember the dictum of one of my professor who used to tell me that in medicine there is only one rule. In medicine there is only one rule, and that is there is no rule in medicine. So why I am saying so? You will have to understand here that every child will be different. Often mothers try to compare their kids with the others kid. So every child is different. Maybe siblings, they also are different. So every child is different, and every child has to be tackled in a different manner, and only the mother's breast is to be given. Now this is again the diagram which is telling you how. Now look, it is the sound of the cry, child's cry. It stimulates the higher brain center, and then the inhibition, pituitary inhibition cells, inhibition is released, and because of that the prolactin is released, and prolactin helps in the milk secretion. And when the baby suckles, then there are mechanoreceptors in the nipple, and then they go up through the ascending sensory neuron to the higher brain center. They goes to the hypothalamus, and then from there they go to the posterior pituitary, and the oxytocin is released, and oxytocin helps in the smooth muscle contractions, so milk is ejected. So prolactin helps in the milk secretion, and oxytocin help in the milk ejection. So that is what they teach you, probably more in gynae or pediatrics. But then yes, you will have to understand that it is the nature's call. Again, you have to understand this. This is the sound of the child's cry, and this is the suckling of the baby. You will have to understand this. Here I would like to tell you, and you can note it down, you can underline it. We will be discussing that further during the course of this deliberation. The best stimulus to refill a breast is empty breast. You can note it down. Again, it will be coming in the presentation. The best stimulus to refill a breast is empty breast. And who can empty the breast? It is the child who has to empty the breast, and that is how you will have to understand that a lot of questions are there. Then before we go to the exactly to the process of breastfeeding and the common problems, you'll have to understand that you have to take care of the lactating woman. She should be in good health. She should take proper balance of rest and exercise. She should not be worried or anxious, because if she is anxious regarding feeding, which happens usually in the first time mothers, then yes, it can create problems with the lactation. And if there is any intercurrent illness, then it should be treated as early as possible. Adequate nutrition, that is why we started when we said we are going to start with a cycle there where we taught you what is the nutritional requirement. So depending upon the stage of lactation, whether the first 6 months or next 6 months, you have to provide 600 to 520 kilocalories per day, and 19 grams to 30 gram extra protein per day, and about 30 gram fat per day, and the other food rich in minerals and vitamins. Now again, you will say, sir, you told us last time, day before yesterday, when we are talking about nutrition education, that you don't have to use the jargon of calories and protein. But this is for you people. You will have to understand the simplest thing which you can always advise, and you do this exercise, I'll be happy if you do this exercise and come back to me. We have done it number of times. You do this exercise with 100 mothers or maybe 10 mothers, and you ask them where the requirement is more, when the child was in their uterus or in their stomach, what they normally call it layman language, and or when the child is taking their milk. 90% or more than 90% time you will find the answer that the requirement is more when the child is inside. Contrary to the truth, the requirement is more when the child is outside. So you have to take care of the nutrition of the mother, and what we say, and there cannot be again a simple formula because it is a heterogeneous country. So what we recommend is, the first recommendation is that yes, the mother should take four meals. In place of taking 3 meals, the mother should take 4 meals, whatever she is taking. If one extra meal is added, then probably the requirement would be fulfilled. But if they ask for specifics, yes, then we say for specifics, yes, we say if they can afford milk, you have to increase the amount of milk. Suppose if the mother is taking 1 glass of milk, we say you should take 3 glasses of milk. If the mother is taking 1 katori of pulse, we say you take another extra katori of pulse. If the mother can eat egg, yes, you always advise egg because they provide you a good amount of protein as well as fat. Then if the mother can eat soybean, then you have to provide soybean. And in our culture, there are so many other things. The Panjeri kind of phenomena are made, which are very, very energy rich, and which can be used for fulfilling the requirement of the lactating mother. That you'll have to understand. And majority of time when we talk of growth monitoring, and when we find a child is not growing well, then we go into the nutritional intake of the mother, and majority of time we find that the mother is not taking enough amount of extra nutrition, and once that is corrected, then the child starts gaining weight. That you'll have to remember, right? So this is again very, very important. Then what is exclusive breastfeeding? Exclusive breastfeeding, the infant only receive breast milk without any additional food or drink, not even water. And WHO has recommended that the duration of exclusive breastfeeding should be 6 months. I have to again discuss this greater in detail. Then technique of breastfeeding. What are the prerequisite? Number 1, infant should be hungry. Number 2, infant should be dry. And temperature should be comfortable, because we have a lot of variations of weather. Now the winters are coming in, so if you are not able to cover the baby properly, then probably he'll be crying because of the cold weather or because of the hot weather, depending upon. Then the child is supported in semi-sitting position, and here I would like to tell you, it's our experience. We have seen it. Of course, some people have different views about it. Mother should never breastfeed the child in a lying posture, because when she does it, then what usually happens, it can result in the perforation of the tympanic membrane, and child suffers from otitis media. That is another point which you must note it down, highlight it. This should not be allowed, and that is why we say it should be in a sitting or semi-sitting position, never in a lying position, never in a lying position. Yes, in the beginning when I told you the cesarean section, then that is not lying. You are putting the baby on the chest of the mother, not by the side. If you do that, a lot of mothers, they do it when they are giving breastfeeding, especially in the night. They just keep on lying, and just on the side they try to feed the baby, and this result in perforation of the tympanic membrane, and then the child suffers from otitis media. So that is another again important point which you'll have to remember. Then helping mother to attach the infant. Now this is again very important, and those of you who have undergone the IMNCI training or have seen the videos, there are videos which are available, and you can see them, how to help mother to attach the infant. There are 4 steps in that. You just have to touch the infant lip with the nipple, and then you'll have to wait until the infant mouth is opening wide. You don't have to force the nipple into the mouth of the into the mouth of the baby or the infant. You just have to touch the nipple with the infant lip. Gradually the infant will open the mouth, and as soon as he opens the mouth, then you have to just push the infant, move the infant quickly onto the breast, aiming the lower lip well below the nipple. Right? This is very, very important. This is there are very good videos which you can see in the MNCI, and if you are not able to see, then probably we'll show you some other time. Right? That is my point number 1. And point number 2, for effective breastfeeding, positioning of the infant. Again, this is taken from the MNCI booklet, and those who have undergone or those who are trainer, they'll be knowing more, that the infant neck is straight or bent slightly back, like you see. The body is turned towards the mother. The infant body is close to mother, and the whole body is supported. Look, the whole body is supported. This is the positioning. The infant neck is straight or slightly bent back. The whole body is turned towards the mother. The infant body is close to the mother. The infant whole body is supported. That is the positioning. Then the next step is attachment. What are the signs of proper attachment? The infant mouth is wide open. The chin is touching the breast. The infant lower lip is turned outward, and more areola is visible on the upper side. You can see it slightly here. This is again a very good picture taken from the MNCI booklet itself. So these are the positioning and attachment. But yes, prior to this, when the MNCI was not launched, this strategy was not there. Even then, the infants were sucking and taking breast milk. But this is more effective method by which the child is able to suckle properly on the breast, right? So that you'll have to remember. These are the few basic things. Now we will be coming to the problems. The problem number 1 is whether we should give one breast or both breasts. That is important, right? We talked of a FAQ that the child is asking milk every hour or so. And why it is happening, we will be discussing that. Ideally, the infant must empty one breast at a time, because I told you in the beginning, I told you that you can write it down, you can underline it. The best stimulus to refill a breast is empty breast. Yes, during the initial weeks of lactation, maybe initial 1 week or so where the colostrum is there, you have to apply both the breasts so that the child is able to fulfill the nutritional requirement. But as the neonate grows, then one breast at a time and alternated in the successive cycles. So say today at 6 p.m. you have given the breastfeeding, so you give the left breast. Another 8 p.m. or 8:30 p.m. you want to give, then you give the right breast, and this should be alternated. Then left, then right, then left, then right. Why it is so? That is important because you'll have to understand the concept now of foremilk and hind milk. What is foremilk? Foremilk is the thinner milk the baby gets, which has got a lower fat content, and hind milk is the high fat creamier milk that follows. There are 2 types of this milk. Now, this is again very, very important, and this is related to a lot of problems. This is related to the problem of child demanding breast milk every hour or child passing motion after every feed. How and why we will be teaching you. Now, this is for the concept of foremilk. The baby start feeding, the foremilk comes, which is low fat, high lactose milk. And then when there is a milk ejection reflex, milk and sticking fat and the ducts are squeezed, then hind milk, which is a high fat milk. Now, look what is happening now. You'll have to understand what is the art. This is what I told you. Yes. And the infant must suckle at the breast for at least 10 minutes to empty it completely. But the problem is this, that again, you see, the infant is a very, very rapid sucker. Infant is a very rapid sucker and will normally sleep within 2 to 3 minutes of sucking on the breast. When we say rapid sucker, it means what usually happening is when the infant is hungry and he is getting a proper attachment in a proper position, then he suckle at the breast very, very rapidly, and he is able to take 50% of the milk. Once he is able to take 50% of the milk, then he goes to sleep. He says, I am now satisfied, and he goes to sleep. Then it is the job of the mother to wake up the infant. Of course, the literature say that you have to gently tickle at the soul of the newborn, but this never happens. I always say, use the nail of your index finger and hit it on the sole or on the shin, and you have to awaken the child. Once the child is awake, then you have to force the child to suckle at the breast for 10 minutes. Why? Now, this will solve two types of problems. Number one problem it will solve, because if the child is able to do that, then what he is doing, if he is suckling at the breast for 10 minutes, what the child is doing now, child is emptying the breast in totality. And what is the best stimulus to refill a breast? Empty breast. Clear? Number two, if a child is able to suckle at the breast for 10 minutes, meaning by he is able to take foremilk and he is able to take hindmilk both, then he is fully satisfied. If you are not going to do it, and if he sleeps within 2 to 3 minutes, he has taken only the lighter milk. And once he has taken only the lighter milk, he goes to sleep. The mother put the baby on the bed or on the couch, and then he wakes up again after an hour or so. And you have told the mother that you have to give the alternate breast. Now, again the mother gives him the second breast. Again the infant suckle for 2 to 3 minutes, and again takes the foremilk. So every time the infant is taking foremilk, and foremilk is diluted milk, so he will wake up again after an hour or so and again demand. So what will happen? Then there is a gastrocolic reflex, as you know, and this persists for 1 to 2 months in the child. As soon as something goes inside his stomach, child passes motion. So if a child is taking breast milk every hour, so in a daytime he is taking milk 12 times, and he will pass motion 12 times, which is normal. But if you have sensitized the mother, and this is the most commonest mistake, over a period of 30 years I have seen this is the commonest mistake. You just have to sensitize the mother over it. If you are able to do that, then what happens is the child has emptied the breast, taken the full amount of milk, he is going to sleep for 2 to 3 hours, and then he'll wake up and then demand. So you have reduced the number of intakes of the breast milk. Thereby you have also reduced the number of motions, right? So there is a great variation, and you will have to remember the simple formula that the number of time child takes breastfeeding, the stool frequency could be equal to that number. Or the other variation is, if the child is on breast milk, the other variation is that a child may pass 8 to 10 motion in a day, and other variation is the child may not pass motion up to 5 days on exclusive breastfeeding. This is the range of normalcy, which you will have to remember. So this is this is the most common problem, and it solves both. Like, which was the FAQ was that my child demands milk every hour. Then you have solved that. Then the next was he is passing motion every time I give him the feed. Again, you are going to reduce the number of feeds. And this usually happens in a country like India. If the child is passing more motions, then what is happening? Then what is happening is you take him to a doctor. You take him to a doctor, and then what happens? Then, if the doctor is not aware of what is happening, then he will prescribe some antibiotics, and child will suffer from antibiotic-induced diarrhea. So this point, this slide, you will have to keep in mind how to solve this particular problem. And you have to remember, he is a very rapid sucker. He'll suckle for 2 minutes. You ask nth number of mothers, you'll find this is the phenomena, and this is to be corrected. By this, you will have to sensitize the mother that, look, the best stimulus to refill the breast is empty breast, and this breast can be emptied only by the child. You have to do it. Your child has to do it. So you have to minimum, this is minimum for 10 minutes. You have to see, it's not only the sucking, it should be a forceful suckling, so that she can see that the milk is going through the neck into the stomach. So that is important to understand, right? Then while feeding the newborn child, every precaution must be taken not to touch the cheek of the other side, which usually mother is very affectionate and does it, because if you do that, then it will distract the newborn from the breast of the mother due to rooting reflex. So that is the phenomena which will happen. So you will have to be very, very careful. You will have to be very, very careful about it, right? So these are the two precautions which you will have to take. And the gastrocolic reflex, we already have talked about that. Normally child passes motion after taking the breast milk, and there is great variation in the defecation habits of newborn children. The child may pass 10 to 14 motions a day, or may pass 1 motion in 5 days while on breastfeeding, and that I've already explained to you is based on the gastrocolic reflex, right? Then comes the question, once you have given the right kind of breastfeeding, you have sensitized the mother, you have to give as early as possible, you have told the mother that you have to take care of the nutrition. Then post breastfeeding, what is to be done? Yes, that is very important. The burping is very, very important. Majority of time, how do people do burping? This is again a phenomenon which is very much less understood by the people. What they do, they take the baby in the lap and just to crash the backside of the baby. This way, it is not going to happen. What has happened is, when the child is sucking on the breast with the milk, he is able to take some amount of air which goes inside the stomach, and that air has to come out. So what is the exact position? The infant should be held erect over the mother's shoulder, remember, and on the shoulder, the stomach, you have to hold the head of the infant in your left hand, and the stomach of the baby should be pressing against your shoulder, and with the right hand you have to give pressure over the back of the stomach, so that some pressure is applied, and because of that pressure, the amount of air which is swallowed is expelled. So otherwise, this will, if you don't do it, then the child will do some spitting of the milk. It may be a raw milk, or it may be a curd-like milk, which can be problematic at times, but this is considered to be a normal phenomena. So burping you have to do, which is very, very important, and post breastfeeding phenomena, this is to be taken care of. Then adequate feeding, yes, you have to allay the fear of the mother. Infant must suckle, I told you, minimum 10 minutes. The range is 5 to 20 minutes, with the exception of the sore nipple, must be allowed to suckle till the infant is satisfied. And what are the signs of adequate feeding? Because you must understand, mother is giving breastfeeding, breast milk, she can't see. So, and she is not a doctor, she does not understand. And I have yet to see a mother in this world who says that the child is eating more. Every mother says the child is eating less. And it starts right from the breastfeeding. So if the child has taken adequate feeding, infant will be satisfied, he'll sleep for 2 to 4 hours depending upon his sleep cycle, and he'll pass adequate amount of urine. And if some mother are more finicky, then you can always advise them to buy a infant weighing scale, and they can take the weight of the child, and if the adequate weight gain is there, normally yes, in a normal birth weight child, you have to take the weight after a month or so, and if the child is gaining around 900 grams, this is a very good weight gain, and you have to continue the process. So these are the signs of adequate feeding, right? So then I think we should stop, and if there are any questions or anything, then we can, maybe we'll be able to you want to ask anything, then probably we may be able to give you the answer. So I'm putting myself into the spotlight, so you'll be able to see me. If you want to write something, which is an hour or so, we have talked non-stop, and we'll be continuing. And I told you that yes, with this kind of approach, with this kind of facility which we have got now, we have time and we can take time. The idea is that you must understand A to Z of breastfeeding. So there are a lot of things which are left, which we'll try to take up tomorrow. And if you are not able to finish by tomorrow with the complementary feeding also, then we'll continue on the third day. And we'll have a brief recap of what we have discussed today. So if you want to ask any question, you are most welcome to ask. Yes, any question? In the above chat, instead of forcing the baby to suck extra milk, can't we store the milk in order to empty the breast and feed the baby later? Now, how do you know it is extra milk? How do you know it is extra milk? If you are going to talk about the milk bank, then probably we'll be talking about a bit later. If any other question is there, I do not know. I'm not able to see. So fine. Okay, if there is any other question, we'll try to answer that. Okay, can a COVID positive mother breastfeed her newborn baby? Now, as far as the WHO, of course, everything is new. You must understand, and I will share with you now. You have asked a very good question, and I will tell you, and I will share you. You see, we are quite senior people, and we have seen how HIV was introduced in our community, right? And when the HIV was introduced in the community, of course, let me first answer your question, and then maybe I'll take 2 minutes on HIV also. Till now, the WHO recommendation is that the coronavirus is not transmitted through breast milk. So if mother has to take the adequate precaution, she has to give the feed hygienically, she has to wear a mask, and she can continue breastfeeding. So there is not a contraindication. That is not a contraindication, right? So I think Dr. Amrish Das has asked this question: can a COVID positive mother breastfeed her own newborn baby? Yes, very well. Till now, there is no contraindication for the breastfeeding because the coronavirus is not transmitted through breast milk. That is one. Now, I was going back to the story of HIV, and when I said when HIV came, and it also became a pandemic because it affected almost every country. and it was easy. But then, because the mode of transmission was not respiratory and there were no incubatory carriers, maybe that way respiratory route was not there, or still not there. So what was the recommendation initially? That yes, you have to you can continue breastfeeding. You can continue breastfeeding. Then the various risks were estimated, and the risk with sexual intercourse was found to be 0.1 to 1%, and with breastfeeding, the risk was found to be 2 to 10% cumulative risk. And they had two types of recommendations. They gave one recommendation for the, again I'm talking of WHO. Remember, WHO keep on shifting its goalpost. So initial recommendation was, for developed part of the world, it should be an informed consent. You inform the mother that the risk is there. If she feel like she can continue breastfeeding, if she does not, she should stop. For developing part of the world, because there are poor people, right? So you have to continue breastfeeding despite the mother is HIV positive, because there are more chances the child will get infection and die. You see, in science, this kind of a discrimination should not be there. It should be informed choice. And we fought over it. Mind it, we fought over it. We said, no, this is wrong. This should not be done. So then the whole scenario, the whole recommendations change. And then they said, yes, it should be with the consent. Then the second recommendation came that yes, if you are continuing breastfeeding, then continue breastfeeding. Don't mix two, because if you mix two, then there are more chances of injury to the nipple by the child. So, and if there is the injury to the nipple, then through the blood, it can get more infection. So this is how the WHO keeps on changing the post. As far as the present scenario is concerned, as far as the COVID is concerned, if a mother is COVID positive, there is no contraindication for the breastfeeding, as the science will emerge later on. Maybe we'll have more knowledge if it is there, if it is found that yes, breast milk is also responsible for the transmission, then the recommendation might change. But at present, it is not a contraindication. Any other question which is there? So thank you so much for attending this, and we'll meet tomorrow again at 6 p.m. and we'll continue with the rest of the problems, and we'll continue maybe with the complementary feeding also, how to start complementary feeding, when to give complementary feeding, and what is the exact mechanism, what is the art behind that, and then we will be trying to finish it by tomorrow. If not, maybe another day or so. I hope you enjoyed this particular lecture. I hope you got some new knowledge which is not given in your conventional book, and it is my own line of thinking is this, that yes, we should give some 2-3 hours to breastfeeding, so that each and every point is absolutely clear in your mind, because you are the people who are going to change the society. You are the change agents. You have to do a lot of work for the people in the community. You have to sensitize the people. Thank you. Thank you so very much for attending this. Goodbye and have a great day.